Hi, it's Jenny, the retired nurse, grandmother for all the way from America. I live in a hillbilly state in the middle of America, and just want to show you that I was able to, in approximately 1 hour and 10 minutes, put together a sepsis timeline using just the internet and the information that I was able to glean from both Thirlwell and the recently leaked document that was sent out. Although I lack the brilliance of a Judith Moritz or Liz Hall, and I did not attend a 10-month trial. I just want to prove to you all that what is the golden thread truly is what Shu Li mentioned in his brilliant international panel back in this February, that the golden thread that went through all of these babies seems to be both bad medical care and our sepsis. So what I'm going to do is provide you with what I was able to easily find, as a sepsis timeline to show you just how bad the situation was at the Countess of Chester. First of all, back in December of 2003, the Cheshire Live noticed that the Countess of Cheshire was one of the most MRSA infected hospitals in the entire United Kingdom. MRSA is a methicillin resistant Staph aureus, one of the worst pathogens that you can find that is spread in a hospital. And then 10 years later, in April of 2013, North Wales Live stated that Countess of Chester had consistently poor performance in relation to MRSA rates, and they urged the NHS not to send any Welsh patients to that hospital. And it was parents in a parents' forum that pushed to have the Countess of Chester forced to improve the standards. Then in November of 2014, following the death of baby Noah, a baby that we know that died due to probable medical negligence on the part of a certain consultant. They did some sort of a risk analysis afterwards to see how the hospital was doing, and it apparently the risk register scored them as high or red status when it comes to Pseudomonas risk. And just an FYI, that baby, the reason the baby was intubated was to facilitate a transfer that it needed to go to probably Alderhay Hospital. It apparently had a necrotizing enterocolitis, which I'm assuming possibly may or may not have come from bacterial infection, and it needed to be intubated so they could get that baby quickly into the operating room once it is transferred. So that baby was what we would call electively intubated, and it was the intubation that resulted in that baby dying. The fact that the consultant ignored 5 warning signs that the tube was placed into what we would call the gullet or the esophagus instead of into the trachea. Okay, so the 2015 and 16 quality account document for the Countess of Chester that was published by its own trust noted a failure to comply with good practice was evident in the post-infection reviews into the cases of avoidable MRSA. And there were 3 avoidable cases of MRSA in the hospital, actually bacteremia, and that means that got into the bloodstream of the patient. And then C. diff, which is another just horrendous bacterial infection that is spread through the GI tract. There were spikes of this in June of 2015, and that was the era of baby A, B, baby Jacob that we will discuss later, and baby D, and an even greater spike in the September of that same year, which was baby G and baby H. They met their cancer targets, but they did not meet their infection control targets. So in 2015, Countess of Chester was found by the NHS to not meet sepsis target guidelines. Only 33% of the patients got an antibiotic in that one we call it the golden hour when it comes to septicemia. And it was the worst performing, it was the fifth worst performing hospital in all of the NHS. And 32% of patients that were diagnosed with septicemia, basically uh, pathogens in their bloods, um, they died. And that was double the rate for the NHS. The average of the NHS was only 17%. In May of 2015, Brewery reported factors in regard to sepsis on the unit, and that was when we first detected Pseudomonas in the faucets. June 6th, baby Jacob is born. That is important, and I will let you know later. June 8th of 2015, baby A dies. June 10th, baby B collapses. June 14th, baby Jacob, and baby Jacob was in the Unit 1 with a cot very close to both baby A and baby B. On that date, it was noted it was swollen everywhere, apparently in his legs, his abdomen, and everything, and that is a clear sign that that baby had some sort of severe sepsis or some sort of a skin infection, and it was transferred, I believe, to either Liverpool, probably Liverpool Women's Hospital. And the baby did come back soon afterwards. So on June 18th, the baby did fine, improved at the hospital, was sent back to the Countess of Chester. But on June 18th, the baby developed abscesses throughout its entire body. And worse than that, it had some sort of a hip bone infection or osteomyelitis. That means whatever that pathogen was, it went to the bone. And again, it was sent back to Liverpool Women's Hospital. And just for your information, baby Jacob, the reason we know about baby Jacob is the fact that baby Jacob was used as some sort of a media thing for the Countess of Chester as a way to appeal, to try to fundraise so they could build a new neonatal unit, and so they can just say how wonderfully they took care of this baby, and just how this baby survived. And the picture of that baby and the mother is on that kind of that infamous picture that we all know we see of Lucy Letby, where she is in kind of a line with, I believe it's one or two of the consultants and a couple of the nurses and this mother and the baby, just with holding signs saying that, you know, where they are in their target so far as fundraising for the hospital. So then on June 20th, baby D is born, and there was 2 risk factors that they should have been assessed for, that she should have been assessed for, that were not detected. June 22nd, baby D dies. Brewery actually admits in an email that probably group strep killed the baby. That is something that is normally found in the flora of a mom, so it's not unheard of. But Lucy says in her text that she texted to someone that they think it might be meningitis. And she was asking if anyone knew if they would do something called a lumbar puncture, which is a spinal tap, to see if infection went to the brain. And it doesn't look like, and according to the trial transcripts, it doesn't look like they even did that. And that should have been done for this baby. This baby was severely septic. June 29th, a senior clinicians meeting noted that standardized antibiotic treatment should have been implemented. That should have been implemented, standardized, years prior to. And stated the use of penicillin and gentamicin should be used in the first 3 days. That's pretty good. And then from day 3 to day 28, you would use then cefotaxime, sorry, I'm bad at pronunciation sometimes, as the first line. And that is a medication that is commonly used to treat meningitis in neonates. August 2nd to the 4th, Gibbs records that baby F is being treated for suspected sepsis. August 4th, baby E dies. August 5th, baby F has insulin issues due to suspected sepsis. September 4th, an unindicted baby dies. And this was basically due to, it had a cardiac issue that apparently wasn't noticed until the postmortem, and the signs and symptoms was there. Brewery was actually the consultant assigned to this baby and chose not to do something as simple as an echocardiogram, which could have picked up this cardiac anomaly. He doesn't believe that this would have killed the baby. And it's something called Epstein's anomaly, and it is something that could be either goes from mild to severe. Um, but what is really noticed about this baby is that it had a positive blood culture of what they call strep A. And strep A is a pathogen that you just don't really see in neonates unless it comes as a contaminant, meaning it probably came from the hands, unwashed hands of someone, and possibly through either and through the fact that the baby had what we call an umbilical artery catheterization, and it probably gained entry through that. We are aware that there was no hand washing facilities available that or was even required prior to entering the neonatal intensive care unit, which is absolutely unheard of. Also, in everything that I am reading in Thirlwall and in the trial, it looks like, and from texts from various nurses that I'm seeing too, and witness statement from them, they are saying that the doctors would first go to the pediatric ward, and they would stay there several hours before they would enter the neonatal intensive care unit. And from an infectious disease standpoint, you always go first to your most immunocompromised patients first, and then you go to the other ones. And the most immunocompromised patients would have been those babies in the neonatal intensive care unit. So I am suspecting that it was probably due to maybe the hands or something that came in from the pediatric ward that could have killed this baby. And also a side note that I have just read through the leaked documents. This was one of the babies that the consultants sent over to the Operation Hummingbird to review to see if maybe Lucy had something to do with it. And what I was able to deem through Thirlwall is that Lucy was involved in the care of this poor child. Luckily, for some reason, Dewey didn't seem to think that this baby was indictable, I believe. That's what I'm guessing, and that's probably why she wasn't indicted for this baby's death. Okay, going on, September 7th, baby G collapses. September 21st, baby G collapses again. September 26th and 27th, baby H has a pneumothorax, and had inappropriate chest tube placements. And what they use steel needles for this baby. Instead of regular chest tube drains, I guess they had ran out of them. And what Shu Li is saying is basically, and any person on the street can easily see that they were probably puncturing the baby's lung again. And apparently the defense during the trial, the defense is claiming that the baby had sepsis also. October, there is no date on this baby, but there is a baby that dies that was from the counters of Chester Hospital that went to another hospital and it died. And this was another baby that the consultant sent over to Operation Hummingbirds to review to see if maybe Lucy is guilty of killing this baby too. But for some unknown reason, it was not indicted. This baby died from what we call multi-organ failure and did not have a post-mortem. Now, multi-organ failure could mean that it went into multi-organ failure possibly because it was deprived of oxygen or it could mean sepsis. October 13th, baby I collapses. October 14th, baby I collapses. And October 15th, baby I collapses. And I believe that it was either at this time or another time, baby I was able to find through Thirlwall that the baby was so incredibly and horribly septic that its blood pressure was collapsing. And it required two intensive care medications simultaneously given, I believe, at the same time. It's called dobutamine and dopamine. And those are medications that should never have seen the light of day at the Countess of Chester Hospital, and is only used, it's used as a low dose in adults for heart failure, and it's used on what we would call telemetry floors, and that's appropriate, but in high doses, it is only used in an intensive care environment in an adult setting. And for the life of me, can't understand how a baby could get so septic and require these two medications. Now, just as an FYI on this situation, on this baby too, it looks as if Countess of Chester did attempt to contact Alder Hey Hospital, and they said no, we don't seem to think it is neck. So go ahead and call Liverpool Hospital, which they did in order to get some medical advice on this situation, and that was the correct thing to do. And Liverpool Hospital, Dr. Yaxel, took 7 hours in order to get back during that, whatever that period was where that baby required dopamine and dopamine at the same time. On October 23rd, finally, a baby eye dies. November, the admits, I'm able to find out through Thirlwall that the admits were due to the neonatal intensive care unit were low. And so this is probably the reason there is a bit of a lull in the death. It's not due to the fact that Lucy wasn't terrorizing the neonatal unit, it's just the fact that they just didn't have very high acuity. December of 2015, another baby that I think the consultants sent over to Operation Hummingbird. I'm going to have to look more into this. But either way, it died. Okay, it died. It had to be transferred to another hospital. And this died due to prematurity with sepsis, and no postmortem was done at the hospital. Again, in December of 2015, we were able to notice that a neonatal intensive care unit had to start administrating. The nurses on the neonatal unit had to either had to bring the babies in or had to go to the maternity ward and administer IV antibiotics to babies that were there that were infected. That's how infected this unit was. This is where also the same time that one of the consultants sent a infamous email to Tony Chambers saying about how safe the issues were in the neonatal intensive care unit. On December 13th, there was an unindicted baby that dies due to sepsis. Now, this baby, it was not sent over to Operation Hummingbird for them to indict Lucy on. What I'm highlighting is the fact that this mother came in, it was a hidden pregnancy. Her waters had broken a long time prior to her being admitted, so both her and the baby were severely infected coming in. So this was an issue that the Countess of Chester was facing and probably wouldn't have had no matter what, wouldn't have had a great outcome either way. But apparently this baby was, this whole event occurred on a weekend. And I am just absolutely gobsmacked that neither the baby nor the mom cultured positive in any way, in any of the cultures for anything. And this baby was so severely infected, they had to use something called amphotericin on it. And that is absolutely the last line. It's not even considered an antibacterial. It's considered an antifungal. It's used in even the most immunosuppressed patients that I've seen in adults, like bone marrow transplants or patients that have had severe amounts of chemo in hopes of killing off like severe yeast and fungal infections. Now, what is notable about this, and possibly one of the reasons Lucy was not indicted on this baby, is the fact that the transport team was supposed to show up within 4 hours, and it didn't show up for between, I think, either 10 or 12 hours. And it's showing just how bad, probably either backed up the transport team was, whatever, not funded well, not staffed well, whatever. And another thing I am real concerned was why the cultures were negative also. And I have to question the laboratory capabilities of the Countess of Chester. It wasn't a regular laboratory they had there. They had something called a satellite laboratory where they would do things on off hours and weekends. Otherwise, it was during business hours. They would send it out to like a central location that they had pooled with a hospital in Wirral. I'm sorry if I mispronounced that. I'm an American here. It's Wirral. So again, I'm wondering, you know, like everything else in this hospital, nothing seems to work. Was this laboratory working very well? And what we're noticing on a lot of the babies that Lucy was indicted for, the cultures or blood cultures came back negative, which, although it's not unheard of, certainly I have to question that at least some of these babies should have had some positive cultures somewhere. Now, January 8th, there is another unindicted baby. This was a twin. It was 30 weeks. The issues with there was issues with the UVC should have been pulled back, and it wasn't. That we had rising lactate, which is a sign that something, the blood cells are dying from lack of sepsis, lack of oxygen, and they're putting out acid. So the blood is becoming acidic because things are dying in the baby. The antibiotics were changed on the advice of, I guess they called Liverpool Women's Hospital, and then again, a second time on the advice of Arrow Park Hospital. So at least they did call them. Now, this arrest on this baby was similar to the time of a twin brother who had already been transferred to Arrow Park Hospital. And apparently, there was no antibiotic policy that was aligned with apparently the Countess of Chester Hospital antibiotic policy was not aligned to Arrow Park Hospital. All of these hospitals should have had the same antibiotic protocol and regimen. This is just absolutely inexcusable. Now, in February 2016, this is another unindicted baby that was born in the Countess of Chester but dies at another hospital due to sepsis and pneumonia. But as I found out through the recent leaked document, this baby went into something called DIC, which is a horrendous condition where you are so septic that your immune system goes absolutely haywire and you basically self-poison yourself because your body doesn't know what to do. It is so overwhelmed with sepsis that it goes into something just absolutely horrendous. And another thing with this baby, there was no postmortem on this baby. Now, February 18th, the neonatal intensive care unit is just closed temporarily due to acuity. That means they had just too many babies there. And an unindicted baby dies due to pulmonary hypoplasia. Now, that is a congenital condition that may or probably is not related to sepsis. I just throwing it out that there may have been a baby there that they know was very, very, very ill from probably maybe a congenital condition, and maybe that mother should have given birth to in a different hospital. Now, there was RSV on the unit at this time, now which is not unheard of. It can happen. It's a common upper respiratory virus that can come in the air. It could have come in from the pediatricians who were spending way too much time on the pediatric ward and doing the rounds first on the pediatric wards before they would come in and check in on the babies on the neonatal intensive care unit. But I'm questioning if the acuity was so high at this time, the census number is so high, that they did not have adequate isolation, or what we would call respiratory isolation, to isolate the babies that had cultured positive for RSV and keep them away from any of the babies. Now, February 20th, this is when the famous baby K dies. But what is noticed is that this baby, although Ravi failed to intubate it correctly, or to ensure that it was intubated correctly, I should say, and also it was also noted on this baby that it had a delay in getting the antibiotics. That is just unbelievable. March 3rd, I noticed there was an unindicted baby that was given an antibiotic called cefotaxime. Again, we don't call it that in America. We call it Ceftin. So I do apologize. Some of my pronunciations are incorrect. That is an antibiotic, although it is used for a lot of things, but mainly it's used in the neonatal area due to meningitis or suspected meningitis. Also in March of 16th, I don't have a date on that. There's another baby that I believe the consultants wanted Lucy indicted for, but she somehow was not indicted for, that had questionable infection on this. But it had, apparently it had, oh, this baby definitely was sent over to, I do apologize, the baby was sent over to Operation Hummingbird by the consultants. The baby had congenital abnormalities, but these congenital abnormalities were not life threatening, and they wanted Lucy indicted for that. Now, we do not know why the baby died, so I have not found any proof that it died of infection. But since most of the babies essentially did, I am assuming that either that or maybe intubation problems led to that. There is a lull. Oh, okay. Apparently on April 9th, there's an insulin issue with baby M. Baby M, we are aware, was having sepsis issues. Now, there is a lull in between April and June, and we do not know why. There was no incidents or anything kind of going on with that. I am just suspecting, and again, like anything else, there's a high for a lot of births happen. A lot of births happen at one time, and then a lot of births do not happen. So maybe the census was low, the amount of deliveries were low, and that's probably the reason. June 3rd, baby N, which that was actually a baby with hemophilia. Again, a baby with hemophilia should have been transferred out immediately. We are aware, according to Dr. Shu Lee, this baby had pneumonia. Now the baby again, it eventually was transferred out, but it was transferred out because they were unable to intubate it. There was an intubation issue in that, and the baby was bleeding severely in the back of his throat due to hemophilia. Now, June 9th, there was another unindicted baby given that meningitis medication called Ceftin. June 15th, this is where again, baby N, the hemophilia baby, was, they attempted to intubate, they couldn't. I think it was several registers, several consultants. And Shu Lee himself noted, he says, under no circumstances, with a baby that is hemophiliac, it should only be the most skilled person attempting to intubate. You do not allow trainee doctors to do this under any circumstances at all. It is too risky. June 23rd, baby O dies, and June 24th, baby P dies. Now, in September of 2017, there was a BBC investigation that featured the Countess of Chester Hospital as an example of hospitals missing sepsis treatment targets. And apparently, according to the BBC investigative report, this was known as far back as 2015. And apparently in 24 trusts with Countess of Chester, and they were using them as an example of one of them failing to administer antibiotics within that first 1 hour, that golden hour, to septic patient, and only 33% of them got that antibiotic within that golden hour. Now, this is odd, and I am just shocked the fact that, again, both Judith and Liz did not do any just simple investigation into 19th century, actually pioneers in germ theory, pathogen management, and this was in the years prior to them even having what we would call germ theory, or they were still in that era where they thought miasmas were causing infections. And this was Ignatius Semmelweis, who taught the world, unfortunately the world did not listen, taught the world that if you wash your hands before you deliver babies, mothers would not die. And then, of course, my heroine, Florence Nightingale, who actually did some incredible work. She actually designed hospitals, and the initial hospitals, and many of the hospitals, all the hospitals built after her recommendations were built, to ensure that sewage was kept as far away from patient wards as possible. And she developed the concept that you have a clean patient, you have a clean environment, and if you have an infected patient, you isolate them. Again, this was before they knew that germs infected. So just wanted to say to Liz Hall and Judith Moritz that I'm calling your bullshit out. And as someone who resides in both a hillbilly state, so I'm not afraid to use those kind of words, but also in a state that has a high amount of rural areas, in other words, a lot of cows, I know the scent of bullshit, and I can smell the scent of bullshit, and I can smell your bullshit. The fact of what you're trying to do and what you tried to do in order to get Lucy convicted. I can smell that bullshit 1,000 miles away. So thank you. And thank you for all for listening to me. And if at any point you feel that any information that I gave that was incorrect, please let me know. Leave in the comment sections below. I, like Nurse Letby, like to self-datex myself. And if I have said anything incorrect, or if you need to add any information, please do it, and I will make sure that it is correct. Bye-bye, and Happy New Year's, everyone.